Hello, everyone. Welcome back to an episode of Health Sciences Today, the official podcast of the Interdisciplinary Journal of Health Sciences. And I'm back again. Two of us. We have here Mr. Stephen Kutcher, a PhD student in epidemiology at McGill University. And I am Professor Rewat Deonandan, also an epidemiologist at the University of Ottawa. And we have a tradition now of having a podcast episode for every election cycle.
Why not?
Do more of them. Yeah.
Every 2 years now, it seems.
We have to do more podcasts, not just election cycles.
Sounds good. We can talk about that.
So we've done some reading a little bit. We looked over the party platforms. And by the way, if you're listening to this in the distant future, it is 2021. This is the fall federal election. The major parties are the ruling Liberals, the opposition Conservatives, the NDP, the Greens, the Bloc Québécois, technically, and the new party, the People's Party of Canada, the PPC. So that's who we're dealing with today.
And we just came out of a minority government, which was the Liberals supported by, I guess, a combination of the NDP and Greens, it seemed, but it depended on the topic.
Well, I guess the Greens only have that one seat, though. So really, how much support can they offer in terms of votes? And we are knee deep in a pandemic, for those of you listening in the distant future. So as we do on these episodes, we go through the platform lightly, not in depth, and compare them for the quality of their healthcare platform. So I don't know where you want to start there, Stephen. Start with the ruling Liberals and see how they're doing?
Or do we start with our classic qualifier that we're talking about federal policies and how we talk about health, how we want to define health is always a challenge between federal and provincial jurisdictions in Canada. There's always a little bit of arm twisting on what is captured by federals and what is captured by the provinces.
That's a very good point. So for our non-Canadian listeners, both of them, in Canada, health is a provincial mandate, and how much influence the federal government has is debatable. But here's a curious thing with these federal platforms, because they're meant for the voter, and I wonder how much the writing of these platforms is meant to blur the line between federal and provincial boundaries, so that the unsophisticated voter assumes that a federal government can do certain things that they can't.
I feel like you're speaking towards a very specific party that has done a pretty good job of it the past year or two. And that they've definitely, I think, blurred the lines of where their jurisdictions lie, and at least how confident they can be in implementing those.
Yes. Yeah, we'll try to be as nonpartisan as we can, but sometimes it's hard when some ridiculous things are being put forward by some of the parties. So, I mean, I'd like to start with the ruling Liberals, if you wouldn't mind. And I made some quick notes of what I've seen in their platform when it comes to health specifically. So their plan is to hire thousands more doctors and nurses. Again, I don't know if that's federal or provincial. Can they do that?
This is where I've read that, again, it sounds like in the whatever the exact term is, but the Canada Health Act, it's a provincial thing. So the like the hospital system, the regulatory bodies, and the data that they collect sounds like it's all provincial jurisdiction.
Yeah, unless they're talking here.
There's definitely health beyond that, but in terms of the hiring of nurses and doctors, it sounds like it's a provincial thing.
But I think maybe the fudge factor word is support. So they're going to offer support to hire those doctors and nurses. So give them money to hire doctors. Okay, I guess you can do that. How you compel usage of that money is anyone's guess. And I anticipate that if they are reelected and they give that money to hire doctors and nurses, it may be fudged again at the provincial level to augment the existing work hours of doctors and nurses. Any number of things is possible. But it's interesting that they've chosen to focus on the healthcare worker supply, which I think is relevant. We have a supply issue in Canada.
I agree. Like we definitely have issues in terms of, I'm in Quebec, I'm at McGill, so we have a lot of conversations about the nursing staff shortages here. So trying to have new available nurses sounds like it could be great, especially during a pandemic when you have specific places that probably require them.
Right.
When surges occur.
Where they come from, I wonder. I mean, where are they hiring these nurses from?
That's a great question. They don't say, obviously. I would like to hope that you could think about maybe some new immigrants that come to the country that have some nursing background in other countries. Maybe they'll try and speed up the process of hiring them.
Yeah, or new grads maybe.
Maybe new grads make more spaces. I'm not sure. I can't say that we know what they plan to do.
Well, they're also planning to hire 50,000 personal support workers, 50,000, and to raise their wages to $25 an hour. Okay, I'm not opposed to raising wages. Sounds reasonable.
Yeah.
50. Where do you get 50,000? I guess the threshold for training for PSWs is not that high.
Possibly. I guess it depends. Like, is this going to be across the country evenly? Is this
right?
Certain places? Again, we're just asking questions. We don't know these answers.
We're just asking questions, people.
Yeah.
We have no answers.
But I definitely know, for example, there's rural locations in Quebec that have a lot of staff shortages, not even PSWs, just generally across the workforce. So yeah. I don't know how they're going to find these kind of staffing issues in places that have them in other sectors as well. So it's going to be interesting how these plans get put into place. They might end up being very well thought out. I don't know. But it's a great idea. It's just how do we implement it?
It just, I always bristle at these federal plans to augment human resources.
I know.
Yeah. Okay. We'll get to the things that actually can do later on, because all the parties, they've jumped on the transfer payments, which is the one thing they can do. So we'll get to that in a second. Let me see. The next step is they have a publicly accessible mental health care. Okay. All the parties are focused on mental health.
All of them. Yep. They all say it. That's a good thing. We're talking about it.
Sure.
Wonderful.
Yeah, it's a good thing, but the details are sketchy.
And basically don't exist in some of them.
Yeah, right. We're pro mental health. Okay, how?
Yeah.
Well, okay, and then the opioid. They all mentioned the opioid crisis, which is important.
Yeah, that's a really good thing that they're talking about. But
how? Okay, let's jump around a bit. So the NDP actually had a plan to address the opioid crisis, and they wanted to start by making it an official public health emergency and end the criminalization and stigma of drug addiction. Okay, at least that's something.
Greens also have decriminalization in their platform as well.
Right, that's right. Okay, so I mean, the Conservatives had a strong mental. They had a huge focus on mental health as well. It's like on their main website. The vanguard of their health platform is built around mental health. I think is interesting. I think they were the least focused on the opioid addiction, if I'm not wrong.
Yeah, I don't remember anything on there. So I'm checking my notes and.
Okay, so going by my list of liberal notes here. 10 days of paid sick leave for federal workers. Okay, I didn't know they didn't have 10 days. I thought everyone had that. So stupid.
Unfortunate. I live with a federal employee, so I actually posed this question to them, and I said, "How many sick days do you have?" And they honestly said, "I'd have to check my bargaining agreement," and that made me ask another question, because all federal employees aren't from the same union or necessarily unionized. They all have different varying degrees of.
Interesting.
So I think it's a bit more of a complicated. How many? Some might, but many others might not as well. So it looks like they're trying to set a minimum standard at least.
Yeah. Okay. Well, that's interesting. I mean, what I wonder though is this focus on federal workers. How does that play with the non-federal worker voter base?
That's a very good point too. But I guess it comes back down to the jurisdictional stuff that we have mentioned, that they're trying to focus on things that they know they can implement, of who they are jurisdiction over. And I guess they can play that wishy-washy game of, we will work with the provinces to do this.
Right.
But how they leverage that in some actionable kind of.
Which takes me to my next point. Another of their points is to have better care in long-term care centers. That's not their jurisdiction.
I know this is another one that popped up in a lot of the platforms that I was curious how they're planning to actually take action on these promises.
Man, it's like we should have a civics class. A national civics class.
We basically have the same discussion every election. We just talk about how there's a lot of promises and we don't know if they can actually implement a lot of these promises.
Well, this discussion will be different because we have a COVID component. And I want to talk about COVID last if we can.
I know, otherwise it would take up the entire.
Exactly. So let's put the liberal COVID stuff aside for now. Move on to the Conservative platform. So they've got, let me see here. They want to, again, boost funding for mental health care, which is great. incentives to employers to provide mental health coverage to employees. I think that's very interesting.
Yeah, I
Yeah,
liked it.
at least what the conservatives have in their back pocket always is leveraging the private sector, right? Looking for a market solution to things, which is interesting. I don't know whether it's good or bad, but it's interesting. So how do you incentivize employers to provide mental health coverage? That is, I think, definitely in the federal wheelhouse, especially for federal incorporated bodies. So I don't know what that incentivization will look like, but okay, you've got me interested.
I thought they'd had one in there and I can't find it. They were trying to do some sort of tax deductible thing when you implemented a certain type of coverage, but it could be crisscrossing with another idea.
Yeah, that was another idea of theirs, a tax incentive issue for, I forgot what it was. I'll look it up later. But I just want to jump to something about conservative platforms always involved a phone number. I don't get this. So they want to create a nationwide 3-digit suicide prevention hotline, which is fine. But last election, a couple elections ago, there was the barbaric practices hotline. I mean,
yeah, the snitch line.
Yeah, these hotlines are a go-to that I don't know how effective they'll be. But again, it is interesting to create a federal 3-digit hotline. That's curious.
I do see this here. It says, encourage employers to add mental health coverage to their employee benefit plans by offering a tax credit for 25% of the cost of additional coverage in 3 years.
Okay.
So that sounds like a small little incentive to try and encourage it.
Okay. Yeah, the tax incentive approach is, again, curious to me. It comes out of the federal tax coffers eventually, indirectly.
Mm-hmm.
I wonder how much of it gets eaten up down the pathway by the time it gets to an employer. I don't know. I'm not an economist or an accountant. I can't pretend.
No, I don't know.
Yeah.
Is a tax break a better use of the money versus taking an actual chunk and spending it on something?
Well, maybe it is. I mean, an alternative would be to make a program. If you make a program, you got to hire people, you need infrastructure, you need physical plant. That eats up a lot of money. Maybe the idea is you've got an existing institution, i.e. the employers, you have existing caregivers, i.e. insurance companies, just shunt funding directly into that system and cut out the middleman. At a certain level, it makes some sense.
Yeah.
What about people who don't have employers or wellness plans?
Yeah, self-employed people.
Yeah, so I would like for this approach to have accommodation for people without that option.
Yeah, it definitely can be expanded, and I don't want to say too much about this because I think I prefer maybe a minority government again, so they can all work together to kind of get these ideas together. But I definitely see promising ideas, and all of them just stand alone. There's
that is the odd thing about these conversations is even though we both have our political beliefs, we're able to see quality in most of the opposition, which either means we're open-minded or gullible.
I guess gullible is possible on a Friday night.
So what do you think of this phone number thing? I don't know what to think about it.
It's the hotline things are interesting. Like I know at university levels, they have these call-in systems as well, but you're talking to a generation, at least at the student level, where kids don't talk on the phone anymore. So it sounds like it's an old thing for maybe an older generation that might have been used. I don't know how used they are. I know when they implemented stuff here at the university, funded from the student healthcare plan, I supported it, but my own big question was I want to know how much it was being used.
Good question.
And versus like if you kind of like a text or something like that.
Yeah, that's what I was going to say. Some kind of chat bot.
Yeah. It doesn't have to be a chat bot. It could be a person texting too, like at a computer. It doesn't just like people just aren't the same on the phone as they once were back in the day. So I'm not against it if it's being used. It's valuable, but I think there needs to be a little bit more envision on terms of maybe a different type of system that could supplement that for the generation that may not be as
so 911 is municipal, right?
Is it?
Isn't it run by individual cities? Is that right?
I don't think so. I think like in Ontario, I think the OPP runs the.
Oh, really? Okay. So
I know the central OPP station in Aurelia has a 911 operating system. I've actually been in it. It was actually pretty neat.
Oh, I don't need to know why.
Why I was taking phone calls at 911, I was
Okay.
calls, but
So I ask because I wonder why a federal national 3-digit number for suicide prevention. Why not just piggyback on a provincial 911 system?
so you want the 911 system to include, to go from, fire, ambulance,
Yeah,
police, and then add in mental health.
sure.
Oh, yeah.
I mean, if their platform is built around not creating more government infrastructure unneededly, which is what conservatives are supposed to say, why create a new infrastructure federally when existing infrastructure can handle the job? Is my question.
Yeah,
So,
because I think too, when you make certain calls through those systems, they might send multiple depending on what they are. Even though if you chose ambulance, they might send ambulance and
sure.
fire. And maybe if you call the 911 line and choose mental health, they might be sending a police officer, but it might provide a different scenario for them to approach it than
Sure.
if they got a straight 911
Okay.
call.
Okay. Just dangling some infrastructural issues. So, all
Yeah.
right. So, well, as we mentioned, we have the one thing that the federal government can do really well in terms of health is to look at the health transfer payments. And so the conservatives want to change it to 6%.
Mm-hmm.
So boost the annual growth rate of transfer payment to at least 6%. Okay. It's not a bad thing in my mind.
Already one of the biggest budget items
Yes.
from our governments, and let's make it bigger. Yeah.
Let's make it bigger. Okay. Like in my opinion, government should be focused really on money on 3 things: health, education, and what's the third thing? I ain't think the third thing. Health and education really is the most important thing. Maybe infrastructure or security.
Roads,
Sure.
travel, yeah. And then
All
I
right.
guess border security.
Okay, so going down the list here. All right, so they spent a lot of time on their platform talking about medical assisted dying. Did you notice that?
I did not. I think I might have missed that part. I didn't really.
Right. So they want to
on
introduce the new Canadian Mental Health Action Plan, which is, curious again, is focus on mental health as part of their whole national health framework. But the changes to the MAID, the medical assisted dying program, is curious. I think my reading of the platform, and for those listening, if you think I've misread it, please let me know. I'm open to my errors, considering that I'm reading while drinking. My reading is that they want to make it a little harder to achieve medical assisted dying.
Now that you mentioned this, I do remember this. Yeah, that is exactly what it is.
And in partnership with that, offering additional services for palliative care, which is again, so what they want to soften the ride to death for those who are dying, but to make it harder to achieve a faster death for those who wish to die. That is my summary, my reading of their platform. So that strikes me as a values-based approach, not necessarily a fiscally based approach. And that seems to be in line with the greater, conservative values platform, I would think. But I think for Canadians to make these kinds of decisions, they should be aware that that is where the stated values of this platform lie, is in opposition to easier medical assisted dying, I think, according to my reading.
I would agree with that statement and what I remember reading. I'm also curious in terms of what they mean by that, in terms of like how they plan to put that into place, and whether there's enough, I guess, usage of this. Because I think they said, as you said, they want to make it. They don't want people to be pushed towards it. And is that something you think is happening? Like, is it a problem that exists?
So let's read the points here. They want to reinstate the 10-day waiting period to make sure somebody does not make this decision at their lowest point. So apparently that 10-day waiting period was removed by the existing government. They want to restore the requirement for 2 fully independent witnesses to ensure that a vulnerable person is not being forced or coerced. All right. Require that any discussion of medically assisted dying only occur if raised by the patient and prevent healthcare workers from suggesting it to someone who's not seeking it. Canadians living with disabilities report regularly being in a situation where it's suggested or pushed them report. Okay. All right. So again, it's a values-based position, and I have no opinion on it. It's just a curious, interesting distinction they have from the other platforms. Nobody else is talking about this, as far as I can tell.
I don't remember reading this in any others as well. I guess because it's they recently, I guess, added it in. The other parties figured it wasn't something that was major to change or make adjustments to. It's
Right.
something that could be valuable to those with those specific ideologies that don't support this type of thing, and they want to make it a little more rigid, which is, I think, fair.
I just
No,
I put my headphones there for a second. Sorry.
we're having a good time tonight.
All right, let's move on to the NDP for a second. So I found their platform of the three major parties the least easy to read.
Yeah.
A lot of text, but not a lot of detail. Just curious.
Yeah. A lot of bolded words.
A lot of bolded words. So for the web designer, I'm not impressed by the web design approach you've taken here. I thought, let me just add some editorial comment here. I thought the liberal website was the easiest to navigate, the easiest to find content in. I thought the conservative website was the most detailed.
Correct.
I thought the NDP website was really just not impressive.
But
now,
they had an index page. So
they had an index page. Yes. I'm not even going to talk about the Greens or PPC yet because they're not major parties. They have their own issues. But the NDP platform, let me see. Their goal is to help Canada become a place where all Canadians who suffer are offered relief. Great. They want to double the direct federal investments in palliative care, focus on palliation again. Interesting. And they want to fill the gaps in public health care to increase access to things like dental, vision, mental health, and prescription medication. All right. You know what's interesting? All the parties except the Conservatives want to offer pharmacare. Did you notice that?
I did.
Yeah. Now I'm wondering how important pharmacare is to most people. I think it's really important to most people.
I think so too. It's not cheap.
It's not cheap. And the NDP, as far as I can tell, is the only party explicitly stating they want to also offer dental, vision, and mental health care covered by Medicare.
Yeah, and I think the Greens want to offer low-income Canadians free care for dental care, and then pharmacare for all.
I think, don't low-income Canadians already have free dental care? I think maybe.
I don't know. Is that a province thing, or
it might be a provincial thing, or even a municipal thing?
It might be. I don't know if it's a national thing.
Yeah, I think you might be right there. So okay, this is curious. Is the NDP proposing a national healthcare system, a Medicare system? I mean, this is constitutionally interesting and might be a jurisdictional problem again. I don't know. I wish we had a lawyer on this call.
I know. I was trying to read through a recent article from a certain lawyer from the University of Ottawa about this and trying to understand a bit more. And,
you know what? We should invite him next time to have this conversation.
Maybe he will spend the entire time talking and we'll just listen.
We'll get a lot more hits, a lot more downloads.
Yeah, maybe, especially during the debates.
Yeah. All right. So the NDP wants to provide dental and vision, mental health, and pharmacare. Great. And again, the focus on the opioid crisis. Okay, so all this talk of the opioid crisis tells me that these platforms were being developed well before the pandemic took hold, because otherwise the pandemic would just dominate all healthcare talk. But prior to the pandemic, the opioid crisis was the big topic. So they want to declare the opioid crisis a public health emergency. I don't know if the public has the stomach for another public health emergency at the moment. What do you think?
That's a good question. I guess it depends on what that means. Declaring an emergency, what does that allow the federal government to do?
I don't know. And again, a viewer or a listener would probably write to us and say, you idiots, it means they can free up these resources and pull these policy levers and do these other things. If that's the case, all right, there's some meat here. If it's just verbiage and rhetoric, then what's the point?
Yeah, I'm not aware of what happens if they declare the opioid crisis an emergency, what they can do.
Yeah, I suspect it probably frees up some money and resources.
Like if we think about what happened during COVID, and not to go too deep into it, the federal government didn't do on its own a lot at the provincial levels. It, I think, opened up a lot of funding, but was that funding allowed because of some sort of emergency levers, or was it because they were in Parliament and just quickly said we need to give them?
Yeah, it's like if you're the government, you can do these things anyway, can't you? I don't know if you need these additional powers.
Yeah, especially if it's only about money, because we can't do anything like actionable specifically
Mhm.
and tell provinces what to do.
Exactly. It's not the War Measures Act.
No. So that's a I don't again
Right.
we're just epidemiologists. We don't have
Exactly.
fancy knowledge.
I think our listeners will be shocked to learn how dumb I really am.
We could calculate our risk ratio, but I can't tell you what to do with it.
Okay, so they also want to end the stigmatization of drug addiction by decriminalizing it, as you mentioned, same as the Greens. All right, so that's distinctive. Nobody else is offering that.
Nope.
So again, so the things we've identified so far that distinguishes these various platforms. I think the medically assisted dying thing and the conservative platform is distinctive. The desire to decriminalize drug addiction is distinctive for the NDPs. I don't recall something that's distinctive for the Liberals yet, but we'll get back to them later on, I think. Those are all my notes for the NDP. Let's move on to the Green. Much like the NDP, they want pharmacare. And they want to change the health transfer rates, basing them on demographics. Okay, because the current formula is based on GDP. So, and that was introduced during the Harper years, and that was sustained throughout the Liberal years. Maybe they're arguing that we shouldn't care what a province can afford. We should care about what they need based upon who lives there. That's different. For sure, that's different.
And I'm curious how that plays in, because there is some sort of equalization process that allows the lesser provinces to gain some monetary support for those who need to provide those type of health services. So I'm curious how that would play into those conversations that I guess have been recently kind of re-implemented by the Liberals back in what, 2015, negotiated by the Harper Conservatives before that. I don't remember the exact time. So does that mean they have to open up that conversation?
They probably do. They probably do.
do.
But my question is, if you're basing this on demographics, whatever that means, does that mean like the number of people who are opioid addicted, or the number of indigenous people you have, or the proportion of the population that are older that needs specialized long-term care? Like the demographics door, once opened, starts a whole suite of conversations that maybe you don't want to have.
Yeah, that's gonna be a long topic.
Right. Unsurprising, though, the Greens have built much of their health platform around climate change and climate health, as they're fully expected to do, and good for them for doing so, because that is their bread and butter. And the other parties touch upon that slightly, but this is their forte, so they'd better develop it well. And tied into climate health, they have a section on Indigenous health. And they're the only platform, the only political party with a platform that explicitly mentions telemedicine, as far as I can tell, which I think most people are on board with now. COVID has accelerated our reliance on telemedicine quite significantly. I'm not sure how they're going to invest in, again, telemedicine from a federal perspective. It is still very much a provincial issue.
That is a good question, as it comes up every
single time. Right? Here's the thing: if people don't realize, one of the big barriers in implementing telemedicine is billing codes. How do you bill someone? Like once, I won't go in too deep on this, but let's say you could create a kiosk and put it in a remote part of the province or country, and had a blood pressure cuff. You stick your hand in and takes your blood pressure, and maybe you can put a drop of blood in there and takes a blood sample and compute your A1C, whatever it might be. And then a screen pops up and there's a nurse there to talk to you. That's great. We can offer all that kind of services at a distance in some sort of science fiction-y world 5 years from now. How do you bill that under your provincial billing system or OHIP? What kind of service has a doctor or nurse provided to you that allows them to get a check in the mail? Weirdly, that has been a barrier to developing and delivering these kinds of services up to now.
Yeah, because I guess it's not simple, because there's going to be different types of kiosks and different types of things, and it's going to require an entire negotiation process with, I'm assuming, the regulatory bodies for the medical system.
And we have people like you misusing the blood pressure cuff for reasons we can't discuss.
And then you still get billed for it.
You still get billed for it. Exactly.
Because I think it was recently in Ontario, they had they wanted to try and open up the billing conversation for certain things, because obviously technology has changed, and they wanted to start changing the billing process based on how technology is updated. And I think there's
Mm-hmm.
a big problem about negotiating those. And that was just like a few small aspects. You're talking about something that's quite big.
Totally, man. It's once you're into the world of billing, the sludge, the administrative sludge, is deep and horrific. Um, but I respect any government or party that wants to open that door and trudge through it. Good for you. It needs some cleaning up. Yeah,
I
the
mean,
climate. Yeah,
you're talking about a party that doesn't have much experience, I think, in the federal level, or to
right.
really know what happens when they open this door.
That's right. I have very little faith that this is something that can be achieved to a large extent. To a large extent, it has to be, I think, pioneered from the province up, not from the federal government down.
Yeah. But I guess there is probably some level of telemedicine that's occurring, and I guess at least they're fair in this that they say they want to expand it.
Sure.
So,
there are some private organizations like Rocket Doctor, Get Maple, Tia Health that offer kind of like privatized telemedicine right now, and some of it's free and some of it isn't. And some of it crosses provincial borders. I'd like to know how that works.
That's an interesting. I didn't know that.
Yeah, you can call up a doctor on Tia Health, for example, and in Ottawa where I live, and get a doctor in Edmonton who answers the phone and give you service. And I don't know if they're billed privately through me or they supplemented by their province. I don't know, but clearly someone has made some kind of negotiation arrangement there. So infrastructure exists.
But because I feel like Alberta also opened up something with a private company in some way to manage through their public healthcare system, the telemedicine sort of process. I don't know the details on it, but I remember the discussion happening and people trying to understand who owned the telemedicine information.
Right.
And because you're talking about provinces that manage your healthcare info,
Good
and if
point.
you're going through a private company, if you're paying through it publicly,
yeah,
does
good
the
point.
private company have access to that info or do they not? Which could bring us to COVID because of the whole talk about vaccines.
Oh, yeah, we'll segue there soon. There soon. So let's move on to the PPC, the People's Party of Canada. So on their list of things, replace the Canada Health Transfer cash payments with a permanent transfer of tax points. Why? That's just, to me, that's just weird. I don't. And they've listed amongst their 5 or 6 key platform points. Are you sitting down, people? One of their 5 or 6 key platform points stated in bright letters on their website that amongst their priorities, once elected, is to fire Theresa Tam. How is that a platform, to fire an individual who would probably step down if you're elected anyway? I don't.
It's an interesting approach.
Yes.
She's definitely been chosen to be an individual for a little bit of vitriol throughout.
I guess so. I just, what I'm trying to say ham-fistedly is I don't want to be biased in this conversation, but I'm biased against the PPC for a number of reasons. Personally, that's my personal bias. And if I weren't, you are singling out an individual in your platform, a federal employee, an unelected federal employee in your platform for your vitriol and attack. It's irresponsible and childish. I'm sorry, I don't like that.
I mean, you can go and read their platform. It's on their website. It's freely available. Go nuts. It's something.
It's something. But in all fairness, let's go through some of their health points, right? So all of their health issues, with the exception of the health transfer payments modification, all of their points are based on COVID. So the entirety of their health platform is repealing the vaccine mandates and regular testing, repealing the vaccine passport for travelers, and I quote, stop bailing out provinces that impose economically destructive lockdowns. That is their platform. And that's going to be replaced by supporting research to discover therapies to treat COVID. In other words, they have nothing to replace it with except hope.
I mean, I don't think there's any hope in there.
Yeah, I don't think we need to talk about that much more. In my mind, it's not a serious platform. But the COVID platforms. So the Liberals, I think, called this election because they were competent on their COVID platform to carry them to a majority government, and that's probably not going to be the case, in my opinion.
You say confident or competent?
I thought when they called the election, they were confident, mistakenly so. But their COVID platform includes mandatory vaccines on planes and trains and in the public service, support for creating credentials for proof of vaccination, in other words, vaccine passports at a federal level, and this is an odd one. Before let me finish, they want to create safer indoor spaces with better ventilation. That's not part of their mandate as a federal government? But you wanted to comment?
Yeah, I was going to say, you mentioned something about the passport, and if I understood it correctly, they want to provide funding for the provinces.
Oh, I see. All right, well,
because
that makes more sense.
I think that's what I read out of theirs. They want to provide funding so that the individual provinces can implement their own systems. I think it largely comes on because they understand the jurisdictional imbalance of the feds don't own the data to the province's healthcare and the vaccinations, and who is vaccinated and who isn't. So I think there'd be some legal issues for them trying to sit there and say, this is our platform, give us the data to fill it. And that might take a long time. And I think under the COVID idea, we don't have time on our hands to implement these things. It has
to be, plus you probably couldn't integrate 10 different provincial systems.
Completely different data systems. And that's the big barrier that I see for the federal, when people say the feds should put their own national system in, it's like, that's not really that easy to do when you have 10 provinces with different data structures and then territories, and I'm not sure how similar they are.
Which should have been fixed years ago, frankly.
We can complain about that for sure, but we don't have time to do that right now. So unfortunately, I feel like that is the correct, if you wanted to do this, you have to give it to the provinces to do.
So the only thing they really have direct power over is the travel aspects of it. And they are saying they're making vaccination mandatory on travel media, planes and trains. And in the federal public service, again, they have control over. The other stuff they have no control over. They're the only party, though, that mentions the magic word ventilation. Right? So maybe the plan is to tie some kind of funding to the provinces on a pledge to improve ventilation in schools, which would be nice.
Yeah, like we'll give you money, but it has to be used in this way.
Right. Now, the Conservatives, their COVID plan is, I didn't see a lot of detail in the COVID plan. They're kind of vague on how they feel about vaccine mandates. Did you find anything?
I didn't see anything on mandates. I felt like they stopped short of that. I think it largely becomes kind of back to that whole values thing. And what
right. I will say so. I will say, though, that they impressed me with one line in their platform regarding COVID, and that is the prevention of future pandemics by looking at the trade in wild animals and in animal markets. No one else is talking about that. I think that's rather forward-looking.
Sure. What leverage do we have to do anything about
nothing?
That?
Yeah.
I mean, how many wild animal markets do we have in Canada?
Right. But they are right, though. They're also focusing on strengthening our laboratory capacity, which is, again, useful.
Yeah.
Canada has pretty good laboratories. We have great laboratories and we have great laboratory employees. We have consistently ranked highly in the world for our human resources. So the Conservatives have at least identified that as a strength they want to enhance further, which is impressive, I gotta say. But they're not talking about vaccine. They're not talking about how to end the pandemic now in Canada.
Yeah. For the mandate versions, they're I think fill of what is becoming the mandate sort of train that every province is getting onto right now, as they want to do rapid testing. They want to replace that with rapid testing.
Yes, which in my opinion is not a proper thing to replace it with.
I don't think it replaces it. It's a great additional tool.
Yeah, and a stopgap until you get vaccination.
And also it comes down to you have a vaccine, I guess a 2-time vaccine. So there's a cost with that, but then you have a rapid test, which you might have to implement many times. And there's probably an extra cost over time with those potentially, depending on how long this goes on for.
Right. Now, I didn't see a lot of COVID stuff in the NDP platform. Did you?
No, I don't have that much written down for them. No, it was not focused very much on COVID.
Well, I mean, there are some comments they've made in the media that they want to help boost the vaccine uptake, but I'm not sure what kind of policies they're going to enact to allow that to happen.
Yeah, like they mentioned COVID quite a bit in terms of we need to prevent further waves of COVID, and but it just retrofitting buildings. It's kind of, I guess, like the ventilation thing for the Liberal
Right.
platform. Like, I don't know what that means. As in, are you trying to apply it to federal buildings that you have jurisdiction over? Are you trying to apply it to the entire country? And that means you have to somehow provide money with sort of strings attached in some way.
Well, I mean, so the two major parties, and frankly, the major parties are Liberals and Conservatives. So the options of the ones who will probably form the government. They have distinct COVID platforms. If I might summarize, I think the Liberal plan is to make vaccines as mandatory as possible and to provide the tools for which provinces can create as much mandatory vaccination as possible. The Conservatives are strangely silent on how much they would like things to be mandatory, with the exception of offering testing as a replacement, but they are offering more clarity on how to prevent future pandemics. So that is the distinction being offered here. I mean, to my mind, the ideal platform would be a combination of the two, of the two parties. If only they could get along.
That's what I've been trying to say for a while to everyone I talk to. I wish we could combine them together. And so that's why I like the minority idea.
Right. Right. But they probably take none of those good ideas in the minority government.
I know. This is the way it works, though. You're never going to have, I guess, a party that magically fits into everything you want. You have to pick and choose what you think is going to...
You should found the science party.
Sure. It will never get elected into anything.
Never. Not when you've got platforms like the PPC, whose number 2 point is to fire a specific non-elected federal employee. I still can't get over that.
I was interested by the Conservatives because they seem to be still, I guess, going after some old rhetoric of how they want to close borders to hot spots and stuff.
Yeah.
And I think if I don't say this too incorrectly, I think it's hard to do that and pretend like there's a single way for things to go.
Yeah.
And because we're so interconnected through.
That's right. Well, so I've been saying for a while now that the countries that have done COVID well have 3 things in common. They got really good at testing. They got really good at closing their borders off to reinfection, and they acted hard, they acted early. So they seem to have taken that one element of those 3 things, closing your borders off to reinfection. But that's an acute phase endeavor. That's not a prolonged phase endeavor, unless you're going for COVID zero.
And we technically did that, albeit late here.
Yes.
And I felt like the opposition Conservatives were very much upset with the decision of how it was done. So I'm very curious how they would implement this sort of thing in a way, as in, are you going to implement such as those COVID hotels?
Right.
Does that mean a hard closure? Or are you only going to go, let's say, like at one point, the UK variant was something what people were worried about. I forget the exact, which one is that? Alpha?
Alpha, that is Alpha.
Do you just close off flights from the UK? But then if you go through
right, they're back doors,
New York, and then they come, like you don't have to close off anything. So then it becomes complicated.
Right. Whereas just closing all the borders and you're fine until
yeah,
things get under control. But we're off a different topic here. So we've covered all the parties. Do we miss anything? Is the Rhinoceros Party still around? No? Any independents running?
They probably do exist. I've never seen a serious platform from any of those.
Yeah. Have we made predictions in the past?
I don't think so.
Should we?
Do you want to?
I don't know. I don't want to. I don't think we should.
No, I don't want to either. Like,
yeah,
I know what I think will happen.
Yeah, we do. We'll talk about offline. I don't think we should.
I don't. There's no point in me publicly trying to.
Right. Exactly.
Guess what things will happen.
So I'll say to our listeners, look, neither one of us are political scientists, clearly, or economists, clearly, or accountants, clearly, or lawyers, obviously. We're barely epidemiologists, but we talk about this stuff once a year, once every 2 years. And if you'd like to contact us, don't. Go to the website. The website of the journal is riss-ijhs.ca. The podcast location has changed, but you get a link there from the journal website, and you can send us a message from the website and tell us how much you hate this podcast and this episode.
Do we leave comments at the bottom of it?
Sure, let's do that. I'll make that possible. So link from that site to the new podcast website, and you can leave a comment there if you want. I would give our email addresses, but I don't want to. Yeah. So hey, everyone, that's any final words there, Stephen?
Get out and vote. That's basically it.
Absolutely.
That's my biggest thing I want to say to people. Go out there and vote.
Yeah, please
Exercise
do.
your right.
Please do. Even if you think none of the options are good enough, I didn't think any of the options were attractive.
No.
I held my nose and I voted anyway because that's what adults do. Yes. So until further ado, I am Professor Rewat Deonandan, and this is Mr. Stephen Kutcher, PhD student, soon to be Dr. Stephen Kutcher.
We'll see. Hopefully one day.
And this has been your Election 2021 podcast. Thank you very much.
Bye-bye.